So welcome guys. In today's session, we'll be discussing about atelectasis, which is just a fancy name of saying your lungs have collapsed. Now, we look at the three forms of atelectasis, that is resorption atelectasis, compression atelectasis, and the contraction stroke CICATRIZATION atelectasis. Welcome all, my name is Wallace Munyiri, and I'm the Daktari. Now, what is atelectasis? It's also known as collapse, and it is the loss of lung volume, and this is caused by inadequate expansion of the air spaces. Now, due to that, it will result in shunting of inadequately oxygenated blood from the pulmonary arteries into the pulmonary veins, and this will give rise to ventilation, the VQ imbalance, and hypoxia. Okay, so how is atelectasis classified? Or you use the underlying mechanism and the distribution of the alveolar collapse. Okay, using those bases, you will classify it into three forms: resorption atelectasis, compression atelectasis, and contraction source stroke CICATRIZATION atelectasis. Now, let me show you a picture of that. Now, you see, this is normal. Yeah, you see, these are normal lungs. You can see, very normal. This is what you want to see as a medical practitioner. That is good. But now imagine you see this, you will be like, where's the right lung? Where is it? It's like it left the group. No. It hasn't left the group. It is there, but it is collapsed. Okay. So this is what you see in atelectasis. Now, let's get into the forms of atelectasis, resorption atelectasis. Now, the resorption atelectasis, as the name suggests, there'll be an obstruction. So in the airway, there'll be an airway obstruction. Okay. And this obstruction will prevent air from reaching the distal airways. Now, due to that, air which was initially present in the airways will be absorbed and alveolar collapse will follow. Now, the most common cause of this type of atelectasis is obstruction of the bronchus. Now, and it mainly occurs post-operatively due to after an operation, there'd be intrabronchial mucus or mucopurulent plugs, and this will cause now the bronchial obstruction. But it may also result from foreign body aspiration, foreign body aspiration, such as in children. You know, children, they like putting things in their mouth. Let's say he or she puts say a marble, and then it gets into the airways and becomes lodged into the bronchioles, and that will lead to, if not promptly removed, can lead to the atelectasis. Also, bronchial asthma, bronchiectasis, chronic bronchitis, and also remember that these three, bronchial asthma, bronchiectasis, and chronic bronchitis, those are fall under the group of chronic obstructive pulmonary diseases. Also, intrabronchial tumors. Okay, and this atelectasis, in fact, may be the first sign of this form of malignancy of the intrabronchial tumor. Tumors which grow into the airway might obstruct it and leading to a resorption atelectasis, and that might be the first sign that the patient has cancer. Also, in resorption atelectasis, the mediastinum will shift towards the affected lung. Very important. Will shift towards the affected lung. Let's look at the second form of atelectasis, which is compression atelectasis. Now, in compression atelectasis, it is associated with accumulation of fluid, blood, or air within the pleural cavity. Okay? Remember the pleural cavity, the pressures within the pleural cavity are usually negative. Okay? They are usually negative to the atmospheric pressure. Now, a frequent cause is pleural effusions. And pleural effusions occur in the setting of congestive heart failures, especially the left-sided heart failure. There'd be pleural effusions. Now, also leakage of air into the pleural cavity, pneumothorax, may lead to compression atelectasis. Imagine if you have a stabbing wound to the rib cage, air will rush into the pleural cavity, and that will lead to a compression collapse or a compression atelectasis. Now, basal atelectasis which results from failure to breathe deeply, commonly occurs in bedridden patients or patients with ascites or during and after surgery. No, during surgery, the patient isn't breathing deeply, and now that failure to breathe deeply will lead to atelectasis. Now, unlike in resorption atelectasis, where the mediastinum was shifting towards the affected lung, in this case, the mediastinum will shift away from the affected lung. Let's look at the last form of atelectasis, which is contraction stroke CICATRIZATION atelectasis. It occurs when local or diffuse fibrosis affecting the lung or the pleura hampers lung expansion. You know, you have some such as the restrictive lung diseases, such as the idiopathic pulmonary fibrosis, or a condition such as pneumoconiosis, especially asbestosis, which can lead to pleural fibrosis with the formation of pleural plaques. This will hamper the lung expansion. And in this case, it is the only form of atelectasis which is irreversible. Okay. Now, atelectasis, except when caused by the contraction or the CICATRIZATION form, is potentially reversible, and it should be treated promptly. Why? You don't want hypoxemia to develop and a superimposed infection of the collapsed lung. So you need, so if it is a resorption atelectasis, remove the obstruction. If it is a compression, if it is a pneumothorax, you need to seal that or remove the offending agent. Okay, so but in contraction atelectasis, that is irreversible. So you need to do that so to prevent hypoxemia and a superimposed infection of the collapsed lung. I think we are done. It was that easy. Yeah, you can see this. The left lung here is there, but is the right lung. It isn't there. It's collapsed. So this is atelectasis or lung collapse. Thank you for your attention, guys, and that's it. Very easy. Follow for more of medical content. Thank you very much.